is this is going to be somebody that doesn't have end range flexion. So maybe you get to 150 degrees or so, and you just can't get the finish. So what I wanted to go through was the scapular decompression mobilization. So we're typically using this in a scenario where, say, the superficial helical angle is very, very horizontal. So the Camporini angle here between the clavicle and the scapula is narrowed. So it would typically be significantly less than 60 degrees when we would want to use this, okay? But typically what you're going to find is this is going to be somebody that doesn't have end range flexion. So maybe you get to 150 degrees or so, and you just can't get the finish. And so what has to happen here is we need the upper dorsal-rostral area to expand, and we need ipsilateral cervical rotation to the limited side. So if Dave is limited in left shoulder flexion at end range, I'm going to use this to reduce the compressive strategy of the superficial musculature, right? So what I'm going to do is I'm just going to take my hand, supinate it, and I'm going to actually apply a little bit of pressure to the superior angle of the scapula with my thenar muscles. So just lift up for a second for me, boss. So I get them. There you go. Perfect. So I'm going to position my hand. So again, my thenar muscles are on the scapula. My thumb is actually resting on his clavicle, but I'm not going to push on that. I'm just going to use it as a point of reference. Now, you can see my fingers come underneath his neck. So I'm actually supporting the lower cervical spine, and then his head is actually on the heel of my hand. But what I'm going to do is I'm going to actually turn him towards that scapula, because I need cervical rotation in the same direction as the side of the limitation. So I want left-sided cervical flexion, which is that rotation right there, okay? And so then he's going to take a normal breath in, and then as he breathes out, I'm just going to follow it down. So I'm not going to actually push it, I'm just following, but now I'm not going to let it come back up. And so now I've got his lower cervical spine turned toward, I'm resisting the elevation of the scapula, and then as he continues his breaths, the scapula starts to drop, and then the Camporini angle widens, and that actually reduces the compressive strategy in the dorsal-rostral area, and he's doing all the work for me. This is actually very, very easy. So as he starts to drop that scap, I just follow it with a little bit more cervical rotation, and he's just laying right on my arm, so he's very relaxed and he's very comfortable throughout the whole thing. So this is very, very low stress for him, and not a significant amount of effort for me either. My thumb position is a point of reference on the clavicle. I'm not actually depressing the clavicle. As I follow his exhalation and it allows the scap to depress, the Camporini angle is expanding. Because of the connection of the clavicle to the manubrium is actually coming up, right? So I'm actually enhancing the anterior-posterior expansion. So hopefully the end result is that at minimum, I'm getting eccentric orientation of clavicular pec, which would be beneficial if I'm trying to get the beginnings of the up pump handle. Because chances are, if I'm doing this, he's compressed anterior and posterior.